still in two minds whether to have a microneedling treatment or not, or maybe you're just curious and you just want to sort of know what's it all about and whether it may be suitable for you. I thought maybe I'll just do a post of just simple questions and I'll answer them here and now. What type of skin concerns does it tackle, or does it address? Well, it addresses multiple skin concerns because it's basically a workhorse. So it can look after your fine lines of wrinkles, it reduces the visibility of it because it's inducing collagen, it can reduce pigmentation, and I've often used it in treating melasma, for example, and it's fantastic because it doesn't involve any heat. It treats acne scarring, fantastic for that as well. It also can treat stretch marks and also minimizes the visibility of your pores. It really is great for that too, treating texture, and also really fantastic when it comes to using it for hair redensification. Also treats rosacea prone skin. Does it hurt? That's the number one question that I tend to get is, does it hurt? The reality is pain is very much subjective. The treatment is not painful, but it can be uncomfortable. Some people use numbing cream. I don't tend to use numbing cream. I work incredibly fast. So really actually most of the session that you'll spend is for me to be able to consult you, make sure your skin is hygienically clean, sterile in fact, making sure that you are ready and safe to have the treatment. But once you have the treatment, it goes super quick. So by the time you actually clocked on that one area has been passed, I've already moved on to the next part. It's to work fast, so really the answer is it all depends, but it's not painful. How many sessions do you need? Usually I would say 3 to 5 sessions and then review. So this is a regenerative procedure. You're not putting dermal fillers to restore lost volume, for example, anywhere you might find a sort of an instant results. In this particular case, we've got to get to switch the actual cascade of regeneration. So that does take more than one session. So if you're just thinking about it as a one session, you might want to have that as a sort of glow facial. But if you want to treat skin concerns such as aging concerns or acne scarring or pigmentation, melasma, for example, you do need to be realistic about it and understand that one session won't cut it. So please don't waste your money. What's the downtime? Well, the downtime can be between 24 hours and 72 hours, but immediately after your treatment, your skin may feel warm, it may feel quite tight. You get that sort of look of almost like a sunburned skin. But honestly, by the time you put the sunscreen on, which you're always going to have after the treatment, it's look as if you've just had a brisk walk in the sun. So it will not be so sort of vast and severe and drastic. Now, what do you do after you've completed your procedure? Well, it's all about hydration and it's all about sun protection. So the first thing we'd ask you to do is not to touch your face, not to wash it or use any other products on it. Avoid rubbing it for the first 24 hours. Avoid exercise. Avoid anything that causes you to feel sweaty and hot, and just make sure that your skin is super hydrated and always sun protected. So how do we minimize the risks? We minimize them by giving you sort of a little bit of heads up. Try to avoid medications such as aspirin, ibuprofen if you're using them for pain. To avoid those because they can run the risk of bleeding and bruising. Also avoid omega-3 fish oils. They can also increase the risk of bleeding and bruising. Follow the pre-procedure steps as well as the post-procedure steps. If you're using actives such as retinoids, such as tretinoin, we generally ask you not to use those, and also afterwards. So just to make sure that your skin is not going to be irritated as a result. So your practitioner needs to be able to use the device, which happens to be medically led or clinically led. Also in terms of the environment that they're working in terms of how clean and sterile they are, the products that they're using, all of these actually affect the risks. Who cannot have microneedling procedures or contraindicated? So pregnancy and breastfeeding is a no-no. Anybody who's got psoriasis, eczema, dermatitis, any sort of active skin condition, then no. Any cold sores, no. Any active skin cancer, no. And anybody who has clotting disorders, have difficulty in sort of forming a blood clot, as in they bleed a lot, then it's no. So for me, it's an absolutely wonderful procedure. I tend to combine them with other products such as mesotherapy products, exosomes. These are really beautiful to actually add onto the treatment. Actually, if I have sort of melasma or even acne prone skin, I tend to be able to use my particular microneedling device and treat those skin concerns as well by combining it with a chemical peel. So if you want to know more about microneedling and you like this type of content, please like, share and follow, and just let me know what your experience of microneedling was. Keep glowing and stay amazing.